Okay, our first principle of aquatic physical therapy cannot go without buoyancy, right? Buoyancy. So the upward pressure of having the water assisting you, right? Buoyancy assisted. So this is when say we have a shoulder patient, right? We don't want her to move past 90. The water's going to keep her. That's buoyancy assisted. All right? Movement on the top of the water. All right? Buoyancy resisted. What is that? Movements that oppose buoyancy. She's pushing down. That's the opposite. Right? She's pushing them towards the bottom of the pool. Right? When you're assisted, it's on top. And then buoyancy supported. What is that? Miss Kinsey's going to show us. Oh, now see, this buoyancy doesn't really support her because she's dense, right? And dense doesn't mean that she's not smart. It means that she has a high muscle content, so she needs a little bit more buoyancy. But guess what? Buoyancy is assisting her, right? Yes. All right. So then we go into where we're looking at the benefits of buoyancy, right? The benefits of buoyancy. And so those benefits are numerous, right? So we already talked about the benefits. Number one, decreases weight bearing, right? Decreases joint compression. Movements a lot easier. Effortless movements, right? We can actually increase their functional abilities so they can do more, they can go bigger, all right? We can increase the movement. It helps to raise the limbs, right, to get them up, buoyancy assisted. It also helps with venous pooling or edema, things like that. So when you have someone that has inflammation, the inflammation is going to get out of their system, and we'll explain that a little bit more. But that is definitely a benefit of the water and of buoyancy. And then again, I always say ease of movement because, basically I can get in and work with the client very easily in the water and go from there. So then our next principle in our aquatic principles has got to be hydrostatic pressure. And hydrostatic pressure it's Archimedes' principle, correct? So it's the force that is placed on a body will have that equal force. Let me take that back. So again, the force that's applied in the water, how much ever force is applied to the water, you're going to get the equal amount coming up out of the water. So that's kind of short and simple. But basically, it is one of those it is one of those principles of physics that you should know about. And hopefully, you guys are going, okay, you're probably already Googling it right now. So, but the reason why I want to say that is because right now, she is at waist deep water. We call that 50% weight bearing. We know that when you're at waist deep water, you're at 50% weight bearing. When you're in chest deep water, right, she's about 25% weight bearing. So we know that if we have someone that comes into the place, they need to stay within their precautions, that if they're in chest deep water, they are going to actually be able to stay at 25% weight bearing. And if it's down by their knees, we know that they're 75% weight bearing. So there you have it. Okay, so next one, our principle is viscosity. And so what is viscosity? Okay, viscosity, it's the friction between the molecules. So can you guys make some friction go? How would we do that? Yes. Go. Right, with speed, faster, making it go, moving in the water. Yes. So that's viscosity. The friction between the molecules. It's that where it makes it to where that the water is a way to strengthen, right? I have a lot of doctors that send patients to me and say, put this patient at, but no resistance in the water. And I try to explain to them that you can't be in the water and move and have no resistance because of this one principle right here, viscosity. Your other principles are fluid dynamics, and within the fluid dynamics is linear flow. So when you go straight forward and back, right? Forward and back, yep. Linear flow. Smooth. We call it in swimming, it's a streamline position, where you're trying to just stay within the flow of the water. But what happens when you want to do some turbulent flow? Then what are we going to do? We're going to try to make some turbulence and make them move against turbulence while they're moving. Makes it a little harder. So you guys are going to have a hard time standing, right? Right? And we know this would be a lot more fun if y'all could do this in the water, but you just have to kind of, all right? There. All right, there's your turbulence. Yay! Okay, so let's go through just a few more things, and then we'll get into what we're going to be doing today. Is we're going to go through 4 different things. We're going to go through upper body exercises. Again, as I explained, we're going to show you all the equipment that we have. We're going to go through lower body. We're going to go through balance and gait. And then we're also going to go through a little deep water stuff. Now in this pool, we don't have like a total deep water, but it's deep enough for us to do non-weight bearing stuff. So that's what we're going to do. Then in the end, we're going to just show you a little bit, just a snippet of our manual therapy that we do in the water. Okay, so that you kind of get an idea of it. All right, so again, effects. This is the physiological effects of being immersed in the water. Okay, number 1, this is centralization of peripheral blood flow. Okay, centralization of peripheral blood flow. It's an increased stroke volume. Hopefully you have cardiac class already. It's going to increase cardiac output, but what is it going to do to the heart rate? It's going to negate it. It's going to keep the heart rate down, right? Because everything's increased here, but heart rate is not going to get increased, and even blood pressure is actually going to be decreased. It's going to reduce the entire vital capacity. So those things are super important to understand, especially when you're going to bring in a cardiovascular patient or someone that has breathing issues. And we understand that by doing that, we're going to help with their overall flow, but not cause any more stress and strain to the heart. And then you'll see you have some pretty nice charts in there that talk about how cardiac output is increased and the things that happen as you get into coming into the water and helping with a person that's immersed in what happens with just getting that venous flow in, helping with inflammation, helping decrease the pain, helping decrease all of the things that is happening with the patient. So, and again, aquatic versus land, when we go through it, most of the studies say that, again, when you look at flexibility, aquatic physical therapy is a little better. When you look at the strength training, maybe land's a little bit better. But all in all, right now, our studies show that when we put people in the pool, that it's actually is just as effective as when we put people on land for strength training, flexibility training, as well as cardiovascular training. And we find clinically that people have less pain, better outcomes. And the best part is they're having fun in here, right? They're always having fun. I come in here, people are always smiling and laughing, and they love it. So, thank you very much.